everybody, it's Dr. Joe Buffiel here, and it is another episode of Abundant Health Naturally. Here we are again today with Dr. Phyllis Russo, as we all know her as Dr-LiveWell. Dr. Phyllis Russo, how are you today?
I'm doing great. Thank you so much for remembering the dash.
Dash,
I
yes.
appreciate it. I am doing much better. We're on a great subject. I know you're gonna start talking about it, but I know pain well. So go for it.
You know pain well. Well,
I
I
do.
hope that we can maybe forego some pain after this conversation. But, a lot of the United States of America, how wonderfully blessed we are. But unfortunately, in that blessing, there's a lot of things that are killing us, namely pain and pain management. Can you imagine that we're dealing with so much pain in our lives today? It blows my mind that we are constantly managing our pain,
Chronic pain.
chronic pain. So, Dr. Russo, do you know what the purpose of pain is for us to?
Well, I'm gonna let you say it because you said it so well just before we started.
So, pain communicates what is happening in our body. So it's a tool, really, if we really think about it.
Yeah, we can't think it's all bad.
No, definitely not. Because in that case, thank you for leading into the next thing of pain. It can indicate progression, as in, say, labor, birthing process. And that can continue for 18 plus years after that. Um,
That was funny.
I try uh, as as we're taking our daughter off to college tomorrow. Another thing of pain is it alerts us to injury and illness. So think about when, say, you're walking in the yard, mowing the grass, as I've had this happen numerous times, and all of a sudden I step in a rut and I twist my ankle. I felt a pain when that happened. Okay, what do I do? Well, in my eyes, I keep on moving. Or in some cases, someone is dealing with pain in their, say, their gut, maybe their lower groin area, and they're wondering, what's going on? Man, I'm buckled over in pain. Maybe it's your appendix. We don't know, but it's an alert system. It's kind of like that dashboard light on your car when you're driving, and all of a sudden it comes on. It's like, what's that? Why is that there? Why won't it go away? Let's put a piece of tape over it and ignore it.
So what you're saying though is that it's a great guide.
It
Like
is.
we think pain is a bad thing and it's certainly not comfortable, but pain can also lead us to our healing.
Mm. I've heard it said once by a motivational speaker that when we want to change, a lot of times we don't change until the pain of not changing is great enough.
I think that deserves to be repeated. Say that again.
So a lot of times we don't change unless the pain of not changing is great enough. So since we're talking about pain, that's an indicator that maybe something needs to change within our social environment, maybe our spiritual life, maybe our physical environment of going on in our body. Maybe we need to eat differently. Maybe we need to think better. So,
So I'm going to add to that too. It really is. I mean, now that we're talking about it, it's like, wow, this is a great guide. Um, Things like meditation,
yeah.
prayer, changing that mindset. Now, that doesn't always take it away, but I'm just saying, just like you said, until the pain gets so bad of not change, that's when we're ready to change. And so, even though, I mean, that's kind of the way humans work, we kind of wait until pain comes.
So, in essence, we should change before we have to.
It is difficult for us. But see, that's kind of the cool thing about God is that there's pain, like there is some sort of indicator light. Now, we might choose to put the tape over it, but He's given us an indicator light. So
Hmm.
it could be a good thing.
I think, that
Not a,
indicator light could be his spirit within us nudging us, maybe giving us that little elbow to the side to say, hey, wake up. Or, kind of like Red Sanford. I don't know if you remember that show
Of course
many
it.
moons ago. I'm dating myself when,
I can't believe
he'd say,
you even know it, but go
he'd say,
ahead.
you big dummy,
Yeah.
So sometimes we need that. We need to be told, you big dummy, do it better, do it differently. Just go down this road instead of that road. Eat this instead of that. So, lastly, the purpose of pain can dissuade us from actions that lead to even more painful outcomes. So,
Oh. So that it goes into chronic pain because I think chronic pain has that element of I've ignored it, I've ignored it, I've ignored it, meaning I've eaten a certain way anyway, I've not taken nutrients when maybe it probably would have been a good idea. I, somebody drinks too much or does certain activities that just don't help until finally they have so much pain that they have to change their life and how they live it and how they eat.
so that also leads into the fact that, as you said, chronic pain in America, more people live with chronic pain than cancer, heart disease, and diabetes combined.
It is the epidemic.
So, and just to give you numbers, and as I edit this and put things together, I'm going to put this slide up for everybody to see. Chronic pain, 116 million people. Diabetes, 30.3 million. Heart disease, 25.4 million. Cancer, 14.7 million. So more than 30% Americans are living with some form of chronic or severe pain.
Hashimoto's is actually more than those other three. It's not quite, I mean, chronic pain is part of Hashimoto's, but Hashimoto's is 70 million. So it's up there and it's more than cancer and the other ones that you had just mentioned. So, and it has chronic pain in it. But sometimes people, we don't, some of this chronic pain out there, nobody knows how to diagnose it.
You're right, because especially with your just saying there, the Hashimoto's, the autoimmune issues, that particular category kind of weaves in and out of all of those that we just talked about: chronic pain, heart disease, diabetes, cancer, because it seems like it has a hold of each one of those. So we have a difference though. We have chronic pain and we have acute pain.
Mm.
Generally, acute pain, we know what's caused or the effect.
I was going to say, also with acute pain, like when we talk about pain, acute pain is necessary. If you fall and you have pain and you've broken your bone, it tells you you better get to the hospital. Acute pain is really a part of our bodies and it's necessary.
Right. It's short and well characterized.
Mhm.
And there's usually a resolution or a fix for it. But with chronic pain, as we know, it's there for a long time. And we often, as you said, they don't know why. It's unknown. And it persists longer than we would like it to be around. Um, and the underlying cause of pain disorders and outcome and often pain control, it's like there's no cure for it.
It is a multiplicity of attack. It's a challenge, but I truly truly believe it can be done. And I think you're going into this as we've talked about beforehand, how Western medicine tries to handle pain in deference to a more holistic setting. Are you not?
I am because, well, we know that the Western allopathic approach to pain doesn't really work well. I mean,
Well,
I
it,
have
it
patients.
hides it well.
It does until your body says, well, you know what? I think I'm smarter than this.
Yeah.
And it comes back to bite you with a vengeance. I mean, as a chiropractor, I'm adjusting people and I'm relieving their pain, allowing their uh, brain body connection to function better. And so that that pain could work itself out naturally, fearfully and wonderfully made, healing from above, down, and out. But then there's someone that has such chronic pain that may not be willing to do nutritional products or herbs, maybe wants to go the route of an injection. And, I don't have a license to tell them to take something or not to in that regard of pharmaceuticals, but I'm doing my due diligence to say, hey, why don't we try this? And I get the question, well, is it going to take my pain away? Is it going to work? And I said, well, have you ever gambled? Have you ever played roulette? Uh, it's a 50-50 chance. We don't know. The medicine that's going in there may reduce the inflammation for a short period of time, but it's not going to cure you. We got to go to the source of why that inflammation in that area is continually occurring and creating more and more pain. But a lot of people don't want to make that change because it's not great enough yet.
Well, I would say that sometimes they just don't like to make that change because people don't like to change.
Mm.
Like there's that element that's so strong. They can be in, I will say, and I get clients who are at their worst. And again, your the quote that you said earlier about, the pain gets so bad, that's when the pain is worse if they don't change. Some of that problem is though that they're so far into it, and they're to a certain extent older and more habitual in their ways. It is really hard for just change alone. And so you can have patients, or I have patients or clients that are in so much pain and still can't seem to get past that part where they just don't want to change. It's so habitual the way people eat, um, the way that they look at nutrition versus drugs, that it might never happen. I mean, I hate to be the bearer of bad news, but here's the bearer of good news. I'm telling you, you can get through chronic pain without drugs. The bad news is that people don't seem to want to make the right changes to get to that point, and that's the sad part.
So I have a question. Do you think that mostly it's because that they have been conditioned,
Absolutely, 100%.
how we have been raised and marketed and branded on how to care for ourselves? And most people, not most, all right, most
Yeah.
have decided not to take responsibility for their own bodies. And thus they reach out to not a practitioner like you and I, but someone else who has a script pad, and they go there and like, doctor, I have this discomfort, this pain, and I just don't know what it is. And they don't sit and listen enough to come up with a plan or an idea of what is going on. They do this test, do that test, and everything's with outside, not, or I'm sorry, still within inside the bounds of their test, yet everything's fine with them, the test wise. So it's just a matter of taking that step and wanting to do something different. I have a little boy that was 4 years old that fell off a swing and had pain. I mean, unbelievable pain, and was seen by my associate. He left, came back a couple days later, having an episode of pain. And I sat down and I looked at the dad and I said, let's get a picture of this, because the way he fell, I want to make sure he did not have a fracture of his transverse process in the lumbar spine. And thankfully, the x-ray comes back fine. No, nothing broken, no pathology, although they did see a little swelling of the liver, hepatomegaly. So he's 4 years old. So I'm thinking, you know what? It's the trauma, the swelling in his body from the impact. Boy comes back the next day, has information given to them that everything's fine. He's a different kid. So sometimes we have to do something, take that step of faith and understanding that if I do this, focusing and listening in the right way, I'm going to get a better outcome.
Did he have hepatomegaly? Is that,
I referred him to their family pediatrician. They said everything was fine. His enzyme levels are fine. She said the X-ray sometimes will come out that way. I don't know.
I don't know if that's true either. Something like that, though, I'd probably give it, even a 4-year-old, a little glutathione, just a little bit to keep inflammation down. I mean, you've looked at enough x-rays to know what a liver looks like. So, but actually they don't. They haven't seen enough. Even a pediatrician might not. So I would kind of second guess that. And enzymes can be normal. That's the other thing. I mean, especially if it's acute. If it is due to that, then it might not show up in the enzymes.
You're
So,
exactly right.
yes.
It
So I
it
wouldn't
is
say
so
it,
acute that it has not created a major change with the environment of that organ to
right.
disrupt that
At least
outcome of those enzymes.
Yeah, at least now. I would be doing, if I were the parent, I would be doing what needs to be done just to keep the liver functioning correctly. And again, simple glutathione can do that. Silymarin, just things for the liver, a couple of herbs for the liver. Do it for a month and then you never have to worry about it again. So, and that's that thing about taking care of something before it becomes chronic. Here's the thing, they turn to people like you, they turn to people like me to really know how to do this preventatively. And I want to go back one other thing. You were saying something, I don't know where my mind was going, but you were saying something about the marketing. I mean, do you know, I think we're one of only 2 countries in the world, something like that, that markets drugs on television. I mean, if you just watch 3 sitcoms, you're going to see 5 to 10 drug companies advertising. We are inundated. Our marketing is what drives us. And we're the ones that end up going into the doctor and going, hey, I saw this drug on television. I hear it works. Let me give you, for instance, on that one. They do a lot of marketing on these biologics for eczema. I have a client that has PMR, polymyalgia rheumatica,
Right.
and they're wanting to put her on a particular biologic. Let me think what that is. Hold on. I had pulled it up because it drove me nuts. Where did I pull it? Oh no, I lost it. Hold on just one sec. It should be, well, you talk and I'll look for it.
While you're looking for that, I want to touch a little bit more on chronic pain.
Go for it. And I'll come back to that.
When we're in chronic pain, most people don't understand how it affects our brain.
Mm.
We lose gray matter in our brain, which results in a cloudy thinking. So your problem solving changes, your approach to situations change. Patients with chronic pain showed a 5 to 11% less neurocortical gray matter volume. And it's just the magnitude of this decrease is equivalent to gray matter volume lost at 10 to 20 years of normal aging. So the more pain that we're dealing with on a chronicity time frame makes us age faster.
Also, in the brain, you're looking at even antibodies of the brain. And so, foggy headedness, depression, anxiety, we think that that's, we think it's about depression and anxiety, but in actuality, it can be antibodies that are formed from this inflammatory chronic pain. And again, you're right. What does it do? Besides depression, anxiety, it's foggy head, and even going more towards dementia and even Alzheimer's as well.
And there's so many connections to chronic pain, autoimmune issues, back to our diet and how we're eating, sugar, cortisol, dysregulation, insulin sensitivity, and even a deeper thing is emotional component when pain becomes greater. A man or a woman who just feels like it's too painful to start anything new again, feels like anything old and broken all over again. I mean, it's just their their drive to want to connect gets squashed. And that's why we see people that are in chronic pain isolate themselves more and more and more.
Well, I'm a prime example of that. I mean, when I was exposed to the mold, and I mean, that was a lot of fatigue. It was a little bit more fatigue than pain. Um, but even with my own Hashimoto's, I have ups and downs. So you and I know the last 2 months of my life has been incredibly difficult, and because of pain, and that had to do with my gut. Um, and to be honest, I'm not sure of the diagnosis yet, but the pain was extraordinary. And with that, I really just didn't want to talk to anybody. I mean, I haven't talked to friends for a couple months. I didn't see a lot of patients during this time. It's been, it is very isolating. And so I get that. And that's the thing, you know, I always say, God, oh, thanks so much for giving me this problem because I know that He has people in mind for me that have experienced it, that are experiencing it, and that I can help. I know it beyond firsthand. The name of my old practice was Firsthand Health Center. I probably should have never named it that because I would know everything firsthand. Broke my knee, had a patient with a fractured patella. I had a fractured patella. Yeah, I
Mm.
get it. I do those things.
Talk about leading by example, huh?
Yeah, can we stop that though? I'm really I keep saying after every one of those, can we stop it? That's all I'm asking. But I didn't honestly, it's so crazy. I didn't think I was going to get through this one, but I did. And we still don't know quite yet. We're still taking tests on it, but chronic pain is that wasn't really it was chronic for 2 months, but that isn't necessarily chronic. Um, But these people, these Hashimoto's people, these autoimmune people, it's all inflammatory. First of all, that pain, that chronic pain is 90% from some sort of systemic inflammation. And you can call it whatever you want to call it. All different autoimmune diseases have all these different names to it, from just chronic fatigue to, fibromyalgia, which we talked about previously. They all are about chronic pain. And we just didn't have that 50 years ago like we do now. And so, again, and we've said it before, but we can go ahead and throw it back in. What are the changes in our society? And that is chemicals in the air, chemicals in the soil, chemicals in our foods, so on and so forth. And so, of course, it's going to be on the rise. 100%. And that's exactly what it is. That's where it's so important to get to people to say, really, I've lived this way for a while, and it's not like it's taken my joy of life away just because I don't go, if I go to an Italian restaurant, I eat this incredible, wonderful salad, or I eat fish or and the way it's prepared, but I'm not going to eat pasta. I'm not going to eat wheat where it has the glyphosates in it. I'm not going to eat the grains that probably have glyphosates in it. I'm going to stay away from it. But that doesn't take away my joy for life.
It's interesting you say that because most of us who have been conditioned to eat a certain way, in order to make that change, because we have felt pain or we've gained weight or we have sensitivities to stress or sugar, or our gut sensitivities, you you can't take away my pasta, you can't take away my bread. Well, then keep doing the same thing. You're going to get the same result. And it is a matter of making that change because if you want it, it only hurts when I do this, then don't do that. I mean, it's sometimes as simple as that. But we, again, it goes back to the conditioning, the branding. This is the American way. This is how we have to eat when we go to this restaurant, or in this particular area, and the portions of what we're eating as well. It's funny we're discussing it this way because just on my walk yesterday morning, we were discussing about how people eat in other countries. The portions are nowhere near what we eat here in America.
Much tinier.
Yeah.
I mean, I've been out there. I mean, I've lived out there, and well, I take that. It depends on where you go. Malta, they still have big portions, which is where I lived. But you go to Italy, and the portions are smaller. France is really small. Spain is also well, it depends on how you eat in Spain, but Spain can be small. At least the servings at the restaurants. So, and they also, interesting enough, after their meals, they get out of the house. Even after their supper, they'll get out of the house. So they're actually very active really before they go to bed. And so they're sort of their metabolism sort of works through it. The other thing, let's not forget, out in Europe, they don't have the glyphosates. We think it's all over the world. It's not. It's here,
And
only
so
here.
we've talked about this before. We're talking about it now. And my brain, not a conspiracy theorist, I'm a truth seeker, that why is it that we go through that here in our country? Why do we have to think bigger is better, more? We're in fear of poverty or that we're not going to get that next meal, so we have to eat in so much abundance that it creates such a dysregulation within our body and creating that inflammatory process. And we see it, you and I see it all the time. We've been seeing it for years, and there is no perfection in our own bodies because we also go through our own stuff.
Mhm.
And but yet we have the tools, we have the knowledge, and the ability to pause, put the brakes on, and say, hey, last night I ate this, or yesterday I was in such a bad posture for a period of time, and I better think differently. It's like when I have a new patient and I go over a report of findings, and I have a sheet called the Activities of Daily Living, the do's and the don'ts. It's front and back. I tell them, I need you to read this. There's going to be a pop quiz on this, maybe 5 visits, 5 weeks, 5 months, 5 years from now. I don't know why I'm saying the word five, the number five, but I want them to take action and understand that the way you sit, the way you stand, the way you sleep, the way you lift things, the way you're thinking has an effect on your pain, on your situation. And if we pause for a split second and just think about it and make a different choice, because researchers in Duke, they have noticed that the number one cause of death is not heart disease, cancer, diabetes. It's poor choices. So let's make some different choices.
I wonder, I mean, I work with certain clients that are very, very willing. I guess my question was going to be, I wonder how we can show our clients and our patients the importance of change, healthy changes. I will say in some of the work that I do, because I work on that counseling aspect of this too, the mental health part of it, is going into the why. I'll give you for instance, and this is sort of not Well, it is. No, I take that back. This patient slash client, because I do counseling with her, so I never know to call somebody a patient or a client, but um, she just got diagnosed with an autoimmune disease. Now, I also found out, I've been working with her for about 4 weeks, and I don't think I ever knew this, but she's also OCD. Now, OCD, of course, is the way it's a brain dysregulation. That's all it is. And, but how does it start? So a lot of times, even with Hashimoto's, you want to go back to, is there any trauma in childhood? So I'm not going to get specific, but there was trauma, deep trauma in childhood. And her OCD protected her. In other words, if everything was just right for her, that was her protection. And if I can fix this, I can fix life, right? And so that was her power. That was her protection when she was a child. But neurologically, it starts to imprint on the brain. And so I guess what I'm saying though is as we get older, sometimes in order to make change, because there is some habitual on the brain itself, in order to make change, sometimes you want to look at that trauma in the childhood and clear that up. Whether you clear it up emotionally, I do it that way. I do something called soul retrieval, where the soul is our pure connection to God. And sometimes in trauma, it breaks in our childhood. It doesn't, God doesn't separate from us, but sometimes it's not God's separating, but sometimes that part of us, that gift, kind of goes off to the side. And that's sort of how I explain it. And we want those gifts back in you. We want you whole again. When somebody's whole again, they do start to make changes. And so I've had the benefit of doing this extra work where I can see them going, you know what? All of a sudden ate, yeah, I could eat without not having grains. I went to the store and didn't, or my husband got this at the store, but I've never ate it. The kids ate it, somebody else ate it, but I didn't eat it, and it really wasn't that difficult. And so sometimes it is good, and we're going to talk about herbs and nutritional factors that you can do. But I think this is so important, is clearing up that trauma we had as a child. And that's, in our humanity. That's what happens in our humanity. And sometimes people can't even hear God and feel his presence when there's so much trauma as a child. And so that's a great way to help this chronic pain. Great way to help it. So is acupuncture. There's so many different meridians that work systemically. It's a whole different paradigm of medicine. And I think acupuncture coupled with chiropractics, you can't beat that.
Well, I agree. I mean, I've experienced that in your office as a patient having acupuncture and chiropractic done on me. And I wish here in the state of Pennsylvania I could do that. It's just so different here. But I'm hoping that God blesses me someday soon with an acupuncturist coming across my path so that we can add that to our office. But we have a lot of tools, and sometimes when we put it all together, everybody does work together for the greater good of the person. Uh, Peeling back the layers of the emotional issues, peeling back the layers of the inflammatory issues, the gut issues, the subluxations, the joints that are stuck and restricted, putting pressure on those nerves, and we getting bad feedback, sometimes good feedback, but again, it's that information. And it just amazes me, of all the years that I've been a doctor of chiropractic and the patients that I've adjusted, how valuable the adjustment is. I mean, I have a patient that comes to me every week, sometimes twice a week. She has chronic neck issues, and I just need that adjustment. Now, granted, she's not using it as chiropractic aspirin, but it helps alleviate and allow her to function better without putting aspirin into her body,
Right.
without putting something in that's going to chemically change and be dependent upon. I mean, we've had an epidemic in our country due to chronic pain and people taking drugs, and now they're addicted to these things. And so we have every 8 to 10 minutes somebody dying due to an opioid addiction.
Mhm. Yeah,
So,
it's kind of a sad place that we live in. And it's funny. I had a patient for years that she was one of my only ones that I had to adjust her once a week. And just not everybody's like that. But I kind of think that it's so much healthier to do a chiropractic aspirin. Not everybody needs it, but there is the occasional person that just absolutely needs it. And, we're fortunate enough that we know other chiropractors that will go, okay, can you just adjust me? And it's not that we haven't done it. I personally haven't been to it because I'm in a new place and, I don't know all the chiropractors here, but I just got an adjustment the other day. I think I told you I fractured my rib, but I didn't fracture it, so that's the good news. And it's funny because I've been out of practice for a long time. So he's got a wonderful x-ray equipment, and it's so good. You can see it in all different um, ways to look at it. I don't even know. To be honest, I know I feel like I'm out of it. I kind of am. But anyways, though, there's absolutely no fracture. And so he adjusted me. And it took like the last 2 weeks or 3 weeks, whenever I thought I fractured this bone, out. I just was out of pain. I was like, geez, I should have probably done this 3 weeks ago, but I didn't. I'm
so
just like everybody else. Yeah,
okay. So we're not
yeah.
immune to it. We have a
No.
tendency to be just like our patients. But you said something that really struck me, that there is a process to everything, especially healing, and especially when it comes to chronic pain. Once we start making some different choices and changes, we may see that process speed up. But just think about, I just the cornfields. You're out in you're out in the Midwest, a lot of cornfields.
Lots
Out
of,
here
especially Nebraska.
in the mid-Atlantic, there's cornfields. But think about, they're about 7 feet tall right now, and pretty soon there's going to be a harvest. But it didn't start that way. There was a seed, and then there was time, and things were done. The soil was cultivated, and that seed, now we get to reap a harvest. Seed and harvest, seed and harvest, sowing and reaping, sowing and reaping.
I always love your analogies.
But we gotta really think about these things. It's a Sowing and reaping is a universal law. You can't hide it. I mean, when you give out of abundance, you receive abundance. You sow sparingly, you're gonna reap sparingly. When you take care of yourself in the most right way, you are going to experience that abundance naturally. And sometimes it just takes you connecting with the right people and taking a step and trusting.
So, if you don't mind, can I give some of the herbs that I would
Please.
use for chronic fatigue? So, I put them out in front of me today just so I wouldn't forget. Uh, I use turmeric or curcumin. I actually use things more with curcumin because it's the curcumin part that works a little bit more on the anti-inflammation or that works on the inflammation. I use ginger sometimes. Ginger is good for gut inflammation, but sometimes it's actually can be just the opposite. So I'm a little bit wary about it. But ginger is good even topically. So if you have like knee pain or something like that, if you can get something that's got a cream or a gel or something like that with ginger, that's very good. There's wonderful homeopathics for arthritis as well. It's not arnica, it's bryonia. And that's wonderful. You can put that on you as a gel. I'm going to come back to white willow bark, but boswellia is an anti-inflammatory, also known as frankincense. And so think about that being, one of frankincense and myrrh. Both of them are very anti-inflammatory. You can get essential oils. I'll tell you what, if you guys go to, it's called hopeweloils.com, oils with an S. And I know there's some essential oil companies out there. Some of them are multi-level, some of them are not, but I don't know anybody else that has birch. Birch essential oil is amazing as a topical. And I'm telling you, you can put it anywhere. You can put it on your joints, you can put it on your muscles. Birch is actually how cortisone started. That's kind of where they first derived it from. And so it's anti-inflammatory. It does incredibly well. As a matter of fact, and this is acute pain, but we did an experiment once with my son. He walked like 25 miles. It was at Carry the Load. Do you guys have Carry the Load on Memorial? Is it Memorial or Labor Day? It might be Labor Day. But no, I think it's Memorial Day. Anyways, he walked 25 miles. I said, you know what? Just for S and grins, let's put a half of your body with the birch and then half of your body without it. And literally, he woke up the next morning and he could move one side, the side of the body that we use birch on. And it was like, oh my God, this is killing me on the left side. So that's how well birch works. I use it all the time with my patients. I got a patient coming in who fell recently. Might not be the go-to for chronic pain, but it definitely still can help you through chronic pain. So that's birch, and Hopewell oils is a great one. Boswellia, frankincense, they actually help in arthritis and osteoarthritis.
I
Devil's
have a
claw.
quick story about Boswellia.
Go for it.
I don't know if you've heard of Carrie Bone from MediHerb.
Oh, very much, yeah.
Okay, so MediHerb has Boswellia complex, which is a combination of Boswellia, frankincense, turmeric, some celery seed. Okay. Now, what they did with Boswellia, they did a study with that compared to Vioxx. Remember Vioxx, the drug for pain,
Oh, that they
Vioxx
had to take off.
Celebrex, that would actually make your heart explode?
Yeah, that they
Okay,
took off the market
right.
not
Well,
quick enough, but
uh,
quickly.
so people that were on Vioxx and Celebrex, it was managing their pain, but actually killing them in the long run.
Yes.
Okay. So Boswellia, alongside this study, when people stopped taking the pharmaceutical part of this to stop their pain, they also stopped the people with the Boswellia. Those that were taking Boswellia, their pain actually lessened. Those that were on the pharmaceuticals got worse because their pain came back.
Mm.
So those that were taking the Boswellia complex, their bodies continued to heal and improve.
Oh, let's not forget that. Thank you for bringing that story up because I forget that with herbs, you don't have to take them the rest of your life. That was a great story. I like that.
It's just like when people come to my office and, once you go to a chiropractor, you always have to. It's like, you don't have to do anything you don't want to.
Yeah,
We're here to come alongside you to help guide you. You get to see the value in what we're doing. And if you want to continue doing it, we're here for you.
agreed. One last one, or actually a couple more. Feverfew. Feverfew is good for RA. Um, so I have another patient, or the one that I was telling, I'm sorry, I might have said it before, PMR. She would probably benefit from feverfew. Those are the wonderful. Now, here's some other oils: peppermint oil, anything in the mint family, eucalyptus oil, rosemary oil, cloves. You can cook with cloves. You can use it as an oil. Even lavender is actually one. And then we want to go to our foods. Anything that's rich in antioxidants. So your berries,
Yeah.
blueberries are good. Strawberries can be an allergen, so I wouldn't put those up in the thick of things. But the blue ones, blackberries, blueberries, raspberries are pretty good too. Again, they're very high in what are known as anthocyanins. I think so, anthocyanins. Sorry, and those work really well, better than what we even highly imagine. I just would stay away from strawberries. And then what about our fish? Salmon, mackerel, all these omega-3s. By the way, anchovies are a very high source of these anti-inflammatories. I know a lot of people, I don't know why people hate anchovies. They're so perfectly salty.
So to combat eating a pizza and having gut issues, we just need to put anchovies on our pizza and it cancels it out.
Hey, you heard it here first. You know, it's funny. If there's certain foods I miss, pizza is one of them. There are, again, I'm just giving like little tidbits, tips and tricks and tips. Um, there are
Can we call
places,
you Trixie?
yeah. Um, there are places that do cauliflower crust.
Yep.
Some of them use like a gluten-free, like an almond crust. Um, Now, with that said, cheese in and of itself can be inflammatory.
And so
Um, yeah, and it's not great for autoimmune, and it's a cross mimicry with thyroid um, antibodies. So it really isn't a great one. I will tell you, I eat cheese at my house because one, I get that A2 cheese. I don't know if you know what that is, A2
ah,
cheese.
I
So
kind of feel
A2
like et tu Brute from
A2. Um, A2, that's so funny you just said that. All of a sudden I got it as soon as I said A2 again. Um, so let's see, what is it? Regular cows, their DNA is A2 and A1, A1 and A2. But there are certain cows that are A2 and A2. And so they made milk out of these from these cows. They didn't make it, they expressed it, and realized that people actually didn't get reactions to them. And so they don't do cross mimicry and they don't produce these other antibodies. So sometimes I get A2 milk. You can get that at Whole Foods. Again, here we have natural grocers, so you can get them at either place. And then there's a company, I think it's called Origins, and they have A2 cheese. And I then do even the raw cheese. So I've done raw cheese for quite some time because it has a higher enzyme content to it. Because once you pasteurize, you've lost
well,
the
it kills everything.
kills everything. So I used to drink raw milk, but even raw milk after a while. But A2 milk and then A2 raw cheese I can eat. And that's the one thing, believe it or not, I have a whole bunch of foods that are bothering me now, but I actually can eat that one. And so you kind of have to make your own pizza with cauliflower crust,
Or
use A2 raw cheese.
or you can
Or
go the carnivore route and make pizza. No bread.
go, oh, go for it. Do you have a recipe?
We do.
You need to put that. Can you put it on the video for everybody?
I can. The pizza, it's a base of ground meat flattened out, and then you bake it, and then you put all your toppings on it, put it back in the oven, and now you have to eat it with a knife and fork, but still, there's no flour.
Oh, it sounds delicious. I never
It
even
is
thought about that.
awesome. It is
Well,
awesome.
use your A2 raw cheese for all your autoimmune people. Find it. I think it's even sold online. Okay, I'm going back to it real quick. Leafy green vegetables, spinach, kale, collard greens. Everybody listen up, write it down. Put me on pause. Um, Very high in minerals, antioxidants, fiber, all can decrease inflammatory markers. And what's the inflammatory marker? Either the SED rate or CRP. Those are the big ones in your regular CMPs. Broccoli. Ooh, broccoli contains sulforaphane, and that actually, I use that with my parasite cleanse that I do with patients. And the reason why is that it actually decreases the cytokines and the nuclear factor, particular nuclear factor kappa. So that is just drives inflammation away. Broccoli, avocados, anything high in vitamin C, lycopenes, tomatoes. I wouldn't do tomatoes. I just looked at that list. I wouldn't do tomatoes because there is a lot of autoimmune reaction to tomatoes. So take that out. Curcumin, just using it as or, cooking with. Ginger, extra virgin olive oil, very, very high in antioxidants with their polyphenols. So make sure you get a high polyphenol virgin olive oil. They're usually European. I don't think you can get them here. I have to order mine online, except I did see one that I did purchase at Whole Foods. They're expensive. Just saying. Oh, if anybody wants their chocolate, you just got to eat it dark and you've got your antioxidants right there.
I'll tell you, I can't stomach plain chocolate anymore. I have conditioned myself to absolutely, it's dark chocolate or nothing.
I agree.
I like the bitterness of it.
Yeah, I was just going to say regular chocolate, milk chocolate tastes almost chalky to me now.
To me, it tastes fake.
Well, that too.
Yeah. I love what we're talking about here. We have so many tools, so many things that people can decipher and write down and so forth. And again, we have a lot of information at our fingertips, but it's like when I'm adjusting a patient, a practice member, and they ask me a question, I'm able to give them an answer right at the table before I go to the next patient. But this avenue that we have here, this opportunity where you and I are connecting with everybody is another great way. You know, it's like when I do spinal workshops within the office. This is my way of doing a spinal workshop where this is my way of giving back and giving you that information. When everybody clicks on our YouTube page or watches us on Facebook, or when you put this out there, they're getting that information. And so a lot of their questions may be answered just by listening and tuning in. And that's all you need to do sometimes. Thank you, everybody. We are going to continue. This is going to be a to be continued version of pain management. This doesn't have to kill you, and it doesn't have to control you for your whole life. There are means of improving your ability to deal with this and not just manage it. So I appreciate everybody tuning in. Stay tuned for that next one. We will talk to you more about this just to help you feel at ease and know that it's not in your head and there is hope. Remember, hope deferred makes the heart grow sick, but a desire fulfilled is a tree of life. We'll see you next time.
Bye, everybody.